Well, as I'm coming to you from Dubbo at the moment, Dubbo, New South Wales, so I've been working here for the last 2 months. And it's really interesting because I've been working across all the practices this year. But it's interesting the different things or the different conditions you see based on location. And what I'm really noticing is so many old trauma-related injuries from falling off horses on straight onto your head, loads of car accidents. It's incredible, actually, some of the stuff we're seeing out here versus, say, somewhere close to, say, Bathurst or Goulburn, where we get way more postural problems just from people sitting too much. So it's really interesting. It's been a good experience. Welcome. I've got a bunch of people who are returning, so it's great to see you. There's also some new faces. And so my name's Dr. Jesse Middleton. I'm a chiropractor, as well as the director at Chiropractic Health and Wellness Centre. And so I'll be presenting this talk tonight. Now, guys, I hope to really keep this engaging. So please, everybody will get more out of it if you ask questions, raise your hand, gives us thumbs up as we're going. The more engaged we are, the more we're all going to get away from it. So I'd really encourage you to do that. So tonight's topic is obviously bulletproof your low back. And this one is exactly the reason I became a chiropractor in the first place. So some of you would have heard my story, but for those of you who haven't, when I was 15, I used to play loads of footy. So rugby union, rugby league. I was weight training, just staying fit, loved it. Anyway, this one game, playing at Stanny's on the number 1 oval, we're running back toward the main building. And I got past the ball. I don't think I'd scored all season, but all of a sudden, it's like the Red Sea parted. There was like this massive gap toward the try line. And so I'm racing down the field with the ball, passing the 50 metre and the 40 metre, the 30 metre. I thought like I could taste the try. And then out of the corner of my eye, I see this bit of a blur and someone's picked me up and absolutely poleaxed me into the ground, absolutely flattened me. When I went to get back up, I had this instant shooting pain down my leg, which now I know is sciatica. At the time, I didn't know what it was. But I remember finishing the game, like proper struggling to finish in the game, but I did it anyway. When I finished the game, came off, someone gave me some painkillers, some Voltaren or something. They said, hey, take this, have a good night's sleep, you'll be fine in the morning. And then when I woke up in the morning, I literally couldn't get out of bed. I think it took me half an hour to get out of bed. It was incredible. And this went on for months. I had painkillers, was doing exercises, but it just wasn't like it was. I had this major sciatica, and that then meant I couldn't do a lot of things, which if you've ever experienced pain like that over a long period of time, it starts to affect your psyche. It's not a good place to be. So finally, Mum, out of desperation, basically said, hey, I'm going to go take you to this guy called a chiropractor. Maybe he can help. And so she took me down to the practice in William Street in Bathurst. Paul Welsh was still there, and some of you used to get treated by Paul Welsh. And he took one look at me, took some x-rays, and then showed me how my spine was twisted. But long story short, put me on the table. And I've been putting up with this sciatica for months. All of a sudden, he does this move where I'm on my side, and I hear this crack. Didn't know what was going on. Kevin, yes, it can assist with restless leg, and we will cover that tonight. And yeah, it cracked my back, instant relief. And then so I saw him over the next few weeks, and he started talking to me about health, where it comes from, how your body heals itself, how your nervous system controls everything. You've got to take care of your spine. It resonated with me so much that I became a chiropractor. And mainly, like, it's just a great feeling to be able to help people with nothing but your hands and the odd webinar. So it's a great profession to be in. So if anyone wants to be a chiropractor, highly recommend it. But so tonight's bulletproof your low back pain. And so because I've experienced it, and because this is like the number one thing we see in the office, I feel like I'm in a pretty good place to give you some insight to it. Now, bit of a warning, tonight is going to go for at least an hour. And I say that because when we're putting this together, I'm trying to think about who the audience is. And if you guys are on this call 8 o'clock on a Wednesday night, you're keen beans, right? Like you want to know more about your health, specifically, obviously, low back pain and what you can do about it. And so I want to make sure that we hopefully over deliver on that. So it is going to be a long webinar, but the goal is that by the end of it, you'll have an understanding of what the pain is trying to tell you, what the anatomy of the spine is, so that you can better understand how to look after it. You can understand what the stresses are which cause these problems in the first place, what the main problems of that cause low back pain are, what your options are, both allopathic, so surgery, medications, chiropractic, and non-allopathic, so chiropractic, and hopefully equip you with some good questions so that whatever route you choose, you're making an informed decision with how you want to take care of it. And if you're on this call and you've got a bad back, hopefully you'll have an action plan as to what you can do for it. If you're on this call and you don't have a bad back, or you've had one, you don't want it to come back, we can give you some good tips on how to stay on top of that as well. So that's our goal. So when we're talking about low back pain, we're talking about tight muscles, restricted movement. So common thing we see is when people have chronic low back pain, is they stop wearing tie-up shoes and they stop wearing button-up pants. They replace them with slip-on shoes and basically tracks because they're easy to put on, because we lose the ability to really bend down and tie our shoelaces or, get dressed basically. Or we find these crazy ways to bend down and pick stuff up. Can lead to leg pain, quite often does, which could be just in the backside, could be all the way down to the knee, could be down to the calf, sometimes even the toes. And that can vary from bolts of lightning going down through the leg, someone stabbing us in the back, burning pain, numbness in just the toes and the foot and the whole leg, can go to weakness, can come on suddenly. In fact, the German word for acute onset, so sudden onset low back pain, is Hexenschuss. And Hexenschuss, as it turns out, literally translates into shot in the back by a witch. So I thought that was interesting because I found that out the other day. But what happens is people come into our office and usually they don't come in saying, hey, I can't bend down and put my shoes on. What they say is, hey, when I wake up, I didn't do anything. I twisted to pick up my car keys, or I twisted to pick up a shoe, and all of a sudden, bang, my back went out. Now I've got this shooting pain down my leg and I'm stuck in this position. What happened? Or they'll say, I can't get out of bed, or it takes me half an hour, 15 minutes to get out of bed in the morning and get going. I'm just like an old man. Or if I sit in a soft chair for 10 minutes and I go to get out, I'm stuck over and it takes me 10 steps to get going. Or if I sit in my car for more than 10 minutes or 20 minutes, my hip starts to just throb and burn. It's intense and I have to get out of my car at least every hour just to walk around. So it's not even the pain really that brings people in, but it's the loss of function. It's the impact that it starts to have on their daily life. And that's really how it starts. But the interesting thing about all of this, if you really look at it, is that these are all symptoms. Okay, so all these things we're describing is basically signals from the body to tell us something's wrong. Now, when we talk about symptoms, it's really important that, in fact, when we do any of these talks, it's really important we talk about symptoms from how you interpret them perspective. Because at the end of the day, if you're getting back pain or sciatica, or you can't get out of bed in the morning, really what it is your body telling you that there's a problem, right? It's telling you that there's damage here, you're moving away from health. Now, it's super easy to understand. If you put your hand on a hot stove, it's going to hurt, right? And it hurts badly so that you remove your hand as quick as possible to stop damaging the tissue. So when you look at it from that perspective, it's actually a pretty intelligent response from the body to give us pain. It's like an alarm system to say, hey, you're doing damage. Funnily enough, though, if we put our hand on a hot stove, we know remove the cause, get the hand off the hot stove. When it comes to back pain, we often look at it differently. And we think, and I hear things like, I just put up with it, it doesn't slow me down, so I just push through it. Or things like, yeah, I just take some painkillers and it feels better. But what that actually means is most of the time that we're taking painkillers to do the things that are creating more damage in the first place. And I'll give you an example. Someone goes home from work early because they've hurt their back. So they take some Voltaren, sitting around, hey, I start to feel better. So then they notice, hey, it's Friday and the lawn needs mowing. So I'd rather mow it now and then I've got the weekend free. I'm feeling better now, so I'll go mow the lawn. So they go mow the lawn, feeling great. Then they sit down. Half an hour later, that Voltaren's worn off and they can't get out of their chair. And they're 10 times worse than when they started. So we want to be careful about how we interpret the symptom, because how we interpret it, if we interpret the symptom as just an inconvenience that we need to medicate away so that we can continue on our daily lives, there's going to be a consequence. And it's usually not a good one when it comes to your health. If we interpret the symptom as a signal from the body telling us, hey, something's wrong, we're damaging the tissue, what is it? What do we need to do to fix it? And then taking action to fix it, that the outcome's going to be better, obviously. Now, what I'm really talking about when I describe this is the two ways or the two approaches when it comes to health. So we call this the illness wellness continuum. And basically, there's two ways to approach health. There's a treatment paradigm, which is to say, if it's not broke, don't fix it. So I feel fine, so I'm not going to worry about my health. Second, I get a problem, headache, back pain, whatever, I'll just take a pill so I can keep going about my day. The problem with that, though, as we get a symptom, and we take a pill or we treat the symptom, brings us back to neutral, but it doesn't fix the problem. So we keep carrying on till that thing wears off. And then we end up in this cycle where we just have to keep taking more painkillers to keep us at neutral, which ultimately means at some point there's permanent damage to the tissue, which means that it's basically there's a disability there. It's not coming back beyond that. You're not going to get full function back, which leads into cascading effects, which we'll go into further along this talk, but essentially robs us of our quality of life and the length of our life. The alternative is the wellness paradigm, which is to say, I don't care exactly that I feel good or not. I'm aware that I could create more health. We all could be. Every human being on planet Earth could be healthier. It's a fact, right? Like there's all things we could be doing. So there's an awareness that, all right, regardless of how I'm feeling, I can be doing more. Getting educated on what those things are, so learning more about our health, learning more about the body. But then the crucial thing is then taking action and actually creating these specific, consistent habits, action steps, which stack on each other and create more health and wellness over time. The interesting thing is the treatment paradigm, it's an instant gratification, but at the expense of a long-term healthy outcome. Wellness paradigm is a delayed gratification. You don't get instant results. In fact, sometimes it can take weeks and months to get a result. I mean, look at it. If you're trying to lose 30 kilos, that does not happen overnight, right? However, if you do it, if you stick with the course and you create more, you actually address the problem and create more health, the long-term benefit, I mean, it's an infinitely better return than getting stuck in the treatment paradigm, because you're rewarded basically with health, energy, vitality, or as much of it as you possibly can. You sleep better, you function better, you're maximizing the quality and the length of your life. So I think it's pretty obvious that the wellness paradigm is the way to go, but definitely takes more effort. I mean, there's always a price to pay. So let's look at the lumbar spine and break it down to the anatomy of it. Your lumbar spine, when I say lumbar spine, by the way, that's your low back. So your low back, it consists of 5 vertebrae. The top one, the highest one, we call L1. The lowest one we call L5. And your L5, this guy right here, sits on your tailbone. So quite often, a lot of people on the call, I'm guessing, have probably had a blown disc before. So you will know that it was probably either L4, L5, so this guy here, or L5S1, this guy down here. They're the 2 common ones. Sits on the tailbone. Then above that, you've got your thoracic spine, which is 12 vertebrae, 12 bones. Then above that again, you've got your neck, which is your cervical spine. There's 7 vertebrae there. Now, if we talk about vertebral segments or motor units, what that is basically 2 bones and a disc. That's a single unit essentially, or movement unit in your spine. Interestingly, every single one of those bones has 6 joints, 6 articulations, and I'll show you. So you've got 2 facet joints. So one here, that's a facet joint, and one here, which would connect to the bone below it. And you've got one on the other side. So there's 4 right there. 4, yeah. Then you've got this disc right here, 5, and then you've got one above it, 6. And then you've also got one below it in some cases, so up to 7. Pretty incredible when you think about it. And so its job is definitely mobility. So your spine is designed to be able to move freely in all ranges of motion, but it's supposed to do that in a very stable manner. Spine is designed to be incredibly strong, and it can be. And as you know, it can also be incredibly dicky sometimes if it's out of line. So it's designed to be strong. It's designed to be mobile. Breaking it down a bit further for you, these joints at the back, these facet joints, they are what guide the movement. So you can move, you can rotate, you can twist, you can bend. The weight typically goes down through the disc, but it's the actual curves or the alignment of your spine, which is where the strength of your spine comes from. So the curves of the spine, or the alignment of the spine, is where it acts like a spring. The disc does not act like a spring. The disc is merely a spacer to separate these 2 bones so that you get a big hole up the back for that nerve to come out. So if you've got a nice, healthy fat disc and your spine's in line, you've got a nice hole there for the nerve to come out, and your spine's functioning pretty well optimally. Now, its job, aside from movement and structural integrity, is basically to protect and act like a suit of armor for your nervous system, because your nervous system lives inside of that. So if you have a look at this, you can actually see this picture down on the bottom left. That's that exact same spinal unit I just showed you, but you can see how the nerves are coming out. And then, as you'd be aware, so you've got your brain up here, the brain stem, and the spinal cord runs down the center of your spinal column, down the center of the vertebrae. the nerves branch out and they feed off into your body. So in this sense, if your spine is in line and moving properly, it's protecting those nerves so that they can do their job, which is crucial because your nervous system is your master system. It controls everything. So you're probably aware, your brain sends signals down your spinal cord. So through the brainstem, down the spinal cord, out the nerves and to different parts of the body. For example, a muscle could go to your eye, could go to your stomach, could go to adrenal glands, wherever you want to go, there's nerves going to them, and they're basically sending and receiving information back and forward, and that's how you stay healthy. Now, what do you reckon would happen then if we went along and cut these nerves just here that went to the intestine? The nerves in the low back, we just cut them, and so the supply to the intestine was disrupted. The intestines aren't going to be happy, are they? They're not going to be very happy at all because they're not getting any information, so they don't know what to do and they can't send any information back to the brain. Now, fortunately, that doesn't just happen. You can't just cut those nerves. But what do you think would happen if that spine gets banged up and starts to irritate those nerves? It goes out of line. So rather than protecting the nerves, it starts to press on the nerves. It's going to start to cause problems. So then the question is, well, why would it do that? Why would your spine just go out of line like that? Well, there's a bunch of reasons. I've mentioned at the very start of this column in Dubbo, I'm seeing loads of trauma. So people have fallen off horses, motorbikes, off bulls, car accidents. So that's obviously going to do it. But then wherever I go in the practices, whether it's here or Goulburn or Albury or wherever, if I look out in the waiting room, everybody's doing this and they're basically staring down at their phone. So then you've got not just macro trauma, like accidents, you've got micro trauma, which is just posture. And so certain parts of the spine are going to cop it more than others. In your low back, it tends to be the L4, L5, and they start to go out of line. This creates a thing or a condition we call subluxation. Now, subluxation is a misalignment of the spine. So this basically happens in a series of events. Bone goes out of line. Again, either trauma or bad posture, something like that. As that bone goes out of line, the soft tissue around it, which is your muscles and your ligaments, they start to get irritated. So the ligaments get stretched, muscles get distorted, they get inflamed. Now that inflammation then starts to basically create swelling, which is going to crowd the hole for where that nerve comes out, and it starts to irritate the nerve. Your brain then recognizes that there's pressure on the nerve and it wants to protect it. And so all your muscles basically spasm around it. It can be either locally, so just in one section, totally globally, as in like the entire thing will lock up. And we see this in the neck with torticollis. People can't turn their neck, or in the low back where you come in stuck to one side. Or we see this with shearers and plasterers. They end up walking around kind of like this. So that the muscles will lock up trying to protect it, stop the movement, stop the damage. Problem with that though, is if it's there for any length of time, and really that's only 24 hours, your facet joints at the back, they stop moving altogether. We start to develop adhesions within that joint or scar tissue, which starts to bind that joint tightly together. And so you start to really lock it down. Now, the biggest problem there then, if that joint stops moving, you lose a thing called proprioception, which comes from the micro movements of those facet joints. Now, bear with me. I know we're getting deeper into it, but it's important to get the concept at least. Proprioception comes from movement of your spinal joints especially, and it feeds and energizes your nervous system. They've actually recorded the sound of it. So if you have a healthy proprioception, you get these when they're recording the sound of the information going up and back from the brain. When you've got unhealthy proprioception, you get more of a and it slows right down. Now, because that proprioception fuels your brain, it takes you effectively out of the stress response, which if you think about it, so you think about movement, if you go on exercise, you get a rush of endorphins, you feel good, takes you out of the stress response. That's what proprioception does. If you lose that proprioception, you lose that ability, you get stuck in the stress response, which then elevates stress hormones, cortisol levels. You start to get these other global effects, which is another talk. But it's cascading events, and we see it every day. Now, long-term, what typically happens, so traditionally, on the left here, once that thing goes out of line, irritates the nerve, that's a fairly acute problem. If it stays that way over the long term though, then we start to get other problems because your discs in here, they rely on movement as well because that's how they stay healthy. So your disc doesn't have a blood supply. It relies on imbibition, which is movement, pumping action, push toxins out, suck nutrition in, stay hydrated. So if that joint gets stuck over the long term, that disc starts to thin. We start to see thinning within about 5 to 7 years of it getting stuck. And then over time, 15, 20 years, in some cases 30 years, that disc will dry out altogether. We end up with bone on bone and you start to get these real big chronic problems. You can imagine the different symptoms or the different feelings and signs you'd get the entire way through that process. And interestingly, it tends to be worse initially, like acute, when we just get the joint misalignment. Then it settles down once the inflammation settles a bit, but the thing remains stuck. And over time, it just becomes this low-grade pain, which is probably worse because we're doing more damage. Subluxation is one way. The second most common way we get it, which is not as common, but still happens, is a slip disc or a bulging disc or a disc herniation. So what you're looking at here, if you look at this thing here, imagine you've been cut across like that and you're staring down into someone's body. Well, at the front here would be the guts and the belly button. That's the back. So if you run your hand down the back of your spine, that thing there's one of the bumps you'll feel as you run your hand down the back of your spine. This is the spinal cord, obviously cut in half, and these are the spinal nerves that come out and then run off in your body, down the leg, to the gut, etc. And this thing here is your disc. So that white, brainy looking thing, that's your nucleus pulposus. This is like a jelly substance, basically water, essentially, jelly. It's encapsulated or surrounded by this red thing, which is a really, really strong ligament. It's called an annular ligament. Now, you can think of it like the peeling onion layers. You know how you pull one layer back and there's another layer and you keep pulling it back? That's exactly how this is structured. You get layer and layer like rings encompassing this jelly. Now, the thing about the disc is, again, it doesn't have a blood supply. So the only way it stays healthy is through movement, spinal movement, and it also doesn't have a nerve supply. So you can basically bust through one of those layers with your disc, not feel a thing, okay? So what happens is, over time, all those things you do that you think, I shouldn't have done that, and you get away with it, you don't really. What happens is that disc busts through one layer, fine, don't notice it. Busts through another layer, still don't notice it. When it busts through enough layers, that either it changes the shape of the disc because you've only got like one or two layers holding that annular in. That disc can then start to press on the nerve. That's a bulging disc. Or if it gets really bad and it properly herniates, busts out. So then you get this material, this jelly, sitting out in basically in the spinal column, putting pressure on the nerves. And you can see here, this is from side on what I'm talking about. So as the nerve exits the spine like that, there's that bulging disc which is putting pressure on it. Now, depending on what level of your spine is and what nerves getting pressed, you're going to get different symptoms. But when we're talking about low backs, the common disc injuries are L4, L5. They're the most common. That's your sciatic nerve. And so what you've got here is a picture of the pelvis. They're obviously legs. That big, fat, yellow thing running down the leg is a sciatic nerve. A couple of things about your sciatic nerve and in terms of how you feel. If you've got a sciatic nerve problem, it's not a leg problem. It's a spine problem. Okay, it's a back problem. It's a nerve and disc problem. It's not a muscle problem or anything else. It's a nerve and disc problem. As you progress, either getting better or worse, you're going to see the symptoms move. The further away the symptoms get from the problem area, that is the back. So the further they go down the leg, the worse you're getting. As they come up the leg, the better you're getting. So I tell my patients this because someone comes in with sciatica or back pain and a bit of pain in their backside. If they came in next week after I've worked on them and they've said, hey, my low back feels fantastic. Thanks, Jess. Now my foot's burning though. You're actually getting worse. If you were to come in next week though and say, hey, my leg's feeling so much better, but now my back's even worse, you're actually getting better because the pain is centralizing. Hope I'm being clear here. So the further away the pain goes, that's peripheralizing, getting worse. The more it's concentrating into the back, even if the pain is more intense in the back, you're getting better. And then the pain in the back will dissipate and you move on. Now, someone asked a question about restless leg. It's a form of sciatica. So you've got fast twitch nerve fibers, slow twitch nerve fibers. If you hit the fast twitch nerve fibers, you get pain like sciatica. If you've got pressure on the slower twitch nerve fibers, you get things like restless leg. So a lot of the time, if we adjust this, we get the pressure off that nerve, most of the time we get really great results with restless leg, especially if you incorporate the right exercises and everything else. So I hope that answers the question there. I know this is getting in detail, guys. I hope this is okay. There's a lot of information. This is what a subluxation or a slip disc looks like on an X-ray and an MRI. So I've got the normal X-ray of a low back from side on here. So just to orientate you, the guts are out here. So that's the front. That thing down there is the tailbone, and that's the back. These squares, they're the vertebrae, the vertebral bodies. Those holes at the back are where the nerves come out, just in there, and those gaps in there are the discs. That's a normal one. And you can see nice even disc spaces, nice big nerve holes at the back, and that nice smooth alignment. Subluxation, see how rather than the bones falling on that nice smooth alignment, you get this step effect. The bones are out of line. So you can imagine they're out of line and you got a nerve coming out right back there, what that's going to feel like. It's not going to feel great. So that's X-ray. And then MRI, that white thing you see down the center there, that's your spinal cord. They're actually seeing the spinal cord. The black thing is a disc, and then the gray things in the middle there, the bones. So see how these discs and bones are in line, and they've got a nice, basically fat space for that spinal cord. As you come down, see the bulge there, but especially there, putting a big kink in it. Believe it or not, that may or may not cause any pain. It's true. It's incredible. Like only 10% of your nerves actually feel pain. So we see people come in with MRIs like this. Sometimes they weren't even getting an MRI for their low back pain or something else, but this came up as just a side note. But hey, by the way, you've got a bulging disc. They don't even feel it. But depending on what nerves are getting compressed, you're going to get a dysfunction. So if that nerve was, say, going to the gut or anywhere else, you can get these other problems that don't seem like they come from the back because doesn't feel like it's related, but that's where it's coming from. In fact, I had one guy come in tonight and he's got pretty much this exactly, but he gets testicular pain, and we adjusted his back, and he started feeling better with the testicular pain. So, and we've done that before. All right. So again, talking about this, how it shows up in our office, obviously you get a whole range of symptoms, but the common presentations, typically again, takes me 20, 30 minutes to get out of bed, can't get my leg into the car, can't get my leg out of the car, can't pick up the kids. If I'm trying to put the kids in their car seat, my back goes, or pick them out of the crib, it hurts, or my grandkids, whatever it is. It's the function that it affects the most. And it's when we lose that stability because those nerves just kept getting jammed and everything locks down. That's what we want to get away from. So having said all that, what are our options to treat it? There's a few options, but there's really only two. It comes down to your objective. So this is where we're talking, well, your goal is what I mean by objective. So this is why we talk about the treatment paradigm versus the wellness paradigm, because depending on your goal, you're going to choose a different thing. The problem is most of us don't realize what our goal is. We just know that we need to be able to pick our kids up again. We just need to drive our car. We don't realize that there's options, and we don't realize that there's consequences to the options that we take. So when we're looking at these things, we need to ask better questions. For example, what are you trying to accomplish? Are you trying to get some relief, or are you trying to actually stabilize and correct this problem so that the pain goes because you fix the problem, not just because you've masked the symptoms? Is that the goal? And then define what a successful outcome is. And I say that because your idea of a successful outcome could be that you don't have any pain anymore, the sciatica is gone, you're able to sit in your car, drive all the way to Perth from Sydney if you want to without any back pain, and that's success. Whereas depending on the treatment you take, success could mean a 20% reduction in symptoms for a day. It could mean that the spine is fused and it's no longer moving, and that's a success, irrelevant of the fact that the sciatica is still there. Got to be mindful of these things. So these are what we call allopathic, or the treatment paradigm options. Heat and bed rest. By the way, bed rest is the worst possible thing you can ever do. And I say that like that used to be the advice. Sometimes people still give that advice, and it's the wrong advice. I say that because if you've got sciatica, the best thing you can do is move, walk, because you want to create that pumping action in your disc, that imbibition, so that you're pushing the inflammation out, hydrating the disc, and that's how it's actually repairing. If you just lay in bed, you're making matters worse. In fact, if you come into our office and you sit in the waiting room, there's those wobble discs that we make you sit on. If you've got a bad back, some people think, I don't want to sit on it because my back's sore. I'm telling you, if you sit on that disc and you properly imbibe in a controlled manner, so wobble from side to side, that will reduce your back pain because it's hydrating your disc, pushing toxins out, sucking nutrition in. Bed rest is not a good idea ever. You've got drugs, pain relief. Again, if your problem is just pain relief and it's a short-term outcome, then that could be a good option. I do think drugs have their place, so I'm not totally anti them. I think if you want to get better, you need to be able to sleep. That's a given. And sometimes pain can just be so constant, it's exhausting. And that just takes away your energy to even repair. So in the short term, the things like sleeping or just getting some relief so you can properly move and just walk, they can be helpful for the very short term. But it's when they start to be used so that you can live your life how you want to, i.e. mow your lawn even though it hurts your back or whatever it is, that's when it becomes dangerous. I had this, again in Dubbo, this guy come in recently. He was an ex-policeman, got in a fight arresting someone in the 70s. Anyway, hurt his low back. Over the next 5 years, he said he had 3 surgeries on his low back. So first off, it was L5S1, then it was L4, L5, then it was L3, L4. Like it just kept going up. Anyway, for the last 30 years, so since 1990, he's been prescribed OxyContin. So he's had OxyContin every day for the last 30 years, but he's also been taking 150, this is what he says, which is 150 endone a month, which is about 5 a day. He's been doing that for 30 years. And we did get x-rays of his spine. It's totally messed up. It's just beyond repair. It's not good. That's an outcome. Probably went a bit too much in detail there, but that's what happens. If we don't address the real problem, we get stuck in this pain cycle. Physical therapy can be good. It addresses the soft tissue around the problem area, around the disc and around the subluxation, but ultimately it doesn't actually correct it, doesn't put the thing back into place. Another one's steroid injections, where they actually inject corticosteroid into the thecal sac around the spine, which is basically to numb it. Surgery, obviously. I guess let's really look at surgery for a second. So I've got some pictures actually. If you're squeamish, you might not want to see these. So these are different types of surgery. And I think I wanted to show you these because sometimes when I talk to people, they talk to me as though surgery is just a good option, but it's almost like I don't have time to spend the next 6 months rehabbing my back, so I'm just going to get surgery. What they don't realize is it's not like just going in and removing a spare part, right? Like you go get the surgery, but then you've got 6 to 12 months of rehab after that. It's like, it's not really saving you time by going down that path. Now, the interesting thing is when it comes to surgery, we expect that it's like the gold standard. It's going to fix our back. But when you look at the studies, and I'll read a couple of these out to you. I've actually just copied these so I could read them verbatim. So this is Australian studies, by the way, through the Cochrane Journal, which is a big medical journal. One of them says most patients having spinal fusion surgery under workers' compensation, so paid for by workers' comp, will not return to the usual job and will still be having physiotherapy and be on opioid medication 2 years after surgery. Opioids being OxyContin, etc., which is a derivative of heroin. Another one says rates of spinal fusions have been increasing and continue to rise, outstripping other surgical procedures for low back pain. In the US, spinal fusions more than doubled from 2000 to 2009. In Australia, rates increased by 167% in the private sector between 1997 and 2006, and almost no increase in the public sector, which is interesting, right? And then this other one, a Cochrane review of surgical fusions for back pain in 1999 concluded there was no published randomized controlled trials that established the effectiveness of fusions for chronic pain, which basically means there's no real research into it. So in 2004, the review again concluded that there was an insufficient evidence for effectiveness of surgery for a firm conclusion to be drawn. A further Cochrane review in 2005 reported variable clinical outcomes ranging from 16% and 95%. There was no evident difference over a period of 2 years between artificial disc replacements and the less expensive fusion technique. And it goes on and on and on. So basically what it says is there's a lot of surgery going on and it's not 100% effective. In fact, a lot of the time it doesn't actually improve anyone's outcome at all. It's just part of the process. Like if you didn't get it 2 years later, you'd be in the same boat, or there's other avenues you could take. So I highlight that because in some cases, surgery really is the only thing that's going to help. 100%. In most cases, though, I think we're too quick to rush to it. And we've got to remember there's whatever option you take, if you've got a problem, bulging disc or something like that, it's going to take time. So look at it and think, well, how much time is all the options going to take? And actually compare like for like, which is to say, ask better questions. So, and this is true when speaking to any provider. So this is me. This is any other chiropractor. This is your physio, your surgeon, your GP, anybody. What you really want to know when it comes to these things is what are the risks? What are the costs? Not just up front, but long term. You know, if I get the surgery, that's one thing. What's it going to cost? What's the rehab going to cost after it, etc.? What are the expected outcomes? Can I interview 10 of your patients? That's I believe, a really, really good question. What does the research say? What are my options? What else can I do? And is this treating my symptoms or is this correcting the cause of the problems? i.e., my goal is symptomatic relief or my goal is correction. what is this option going to give me? Getting really clear on what you're engaging in from a treatment perspective. All right, so they're the allopathic options when it comes to treating back pain. Now, we spoke about the spine going out of line before, and I think the spine protects your nervous system controls the body. So you really have to have a healthy spine if you want a healthy nervous system. So the question is, what causes it to go out of line? And this is a whole other webinar, but we talk about the different stresses which will affect it. And these do come out physically within your health. So we talk about thoughts or emotional stresses, talk about toxins, for example, smoking, drinking, alcohol, drugs, medication, as well as the foods we eat, water we drink, and then trauma. Trauma is what we're focusing on here today. And like I said before, there's two main types of trauma. You've got macro, which everybody knows about. This is falling off a horse onto your head. This is a car accident, getting run over by a car, football accidents, you name it, right? This is high energy, sudden impact macro trauma, which obviously knocks things out of line. The most common problem, though, is sitting too much. That is, for most of us, the biggest issue. It's the micro trauma. It's the sitting which deconditions our body. So the muscles start to weaken, or it's maintaining just a really bad posture over years. Like you can imagine, if this guy sits there like that for 8 hours a day, 5 days a week, and does that for 20 or 30 years, things are going to go out of line. You're going to start to get wear patterns and all these other things going on. So micro trauma is the insidious one. And I would tell you this has got nothing to do with low back pain, but it's worthwhile noting, I've said this one before. I'm looking at when I first started, which was only 14 years ago, if I was taking x-rays of somebody, I'd never see any arthritic change in a 20-year-old. Very rarely a 30-year-old. Mostly you'd start to see it after 40. Fast forward to now, and I do see arthritis in 20-year-olds' necks. And the difference is when, I'm going to say we, because probably everyone in this call is more than 20. When we were kids, we weren't sitting down staring at a phone or an iPad. You look at kids now, and for the last 20 years, they've spent a massive amount of their life doing this, staring down. And so they've had 20 years to develop these problems that we never did, meaning they're now getting arthritic change. So it's a big issue. And if you've got kids, just be aware of it. So, and they say sitting is the new smoking. For that very reason, it's like that harmful to your health over the long term for a number of reasons. All right. And this slide here was to say, and I mentioned it before, less than 10% of your nerves feel pain. And this is why. So this is a cross section of a nerve. You've got this small one just here, which feels pain, regulates your posture, gives you sensation, hot and cold. So pain is just one small portion of that. The rest of your nerve is motor nerves, control muscles, or sensory nerves, autonomic, controls organs, gut function, etc. So only a small portion of your nerves feel pain, and whichever fibers you're getting irritated, that's the sort of problem you're going to get. So it ties back to the restless leg. If it's pushing on a pain nerve, you feel pain. If it's not, it's pushing on the slow twitch nerve, you're going to get restless leg. All right. So question then, how do you know if you're subluxated? Especially given we just said that you can have these problems going on and not even feel pain. How do you actually know? Because that's more common. It's more common for these things to be out of line over 10, 15 years, just from bad posture, what have you. We feel fine. Then one day we twist, pick up our car keys, and then bang, we've blown a disc, sharp, sudden pain. The problem's been building up for 10, 20 years, and then there's an accident waiting to happen and it just goes. The only way you can know is from getting tested. Just like if you want to know if you've got high blood pressure or cholesterol, you get a test. So specifically in our office, this is what we look for. As a chiropractor, we detect and correct subluxations. So the way we do it is we use instruments. So we use a nerve scan, which looks at areas of inflammation in the spine. So which nerves are inflamed, shows us what the muscles are doing, where they're out of balance. So whether it's muscle spasm versus not. We use motion palpation to see how the joints are moving, whether they're not moving properly or they are moving properly. We do postural analysis. We take x-rays. So it's this massive process to actually see what the state of the spine is, where the subluxations are. By the way, you have to do this at the start, in my belief, because then when you start working with someone, you want to be able to redo those same tests and actually be able to objectively measure and demonstrate that there's changes. So I'm a big advocate for testing and retesting and not just seeing how she goes. So yeah, get checked. Now, if you do have subluxation, you do have a bulging disc, if you go down the chiropractic approach, so if you go down the approach of getting these tests done, recommendations are given. Success of the outcome determines on 3 factors. One is getting adjusted, getting the right adjustment in the right frequency. That's crucial to realigning it all, realigning the disc, the bone, what have you. But also gets the joints moving properly so you're increasing proprioception, etc. That realigns the spine. Now, the next thing you need to do is exercises, because if you don't strengthen the soft tissue, the muscles and ligaments around it, it's not going to be stable and it's going to keep recurring. So that's number three. Number two, which I believe is the biggest part of the equation, is breaking the bad habits that cause the problem in the first place. Because if you get adjusted every single day, you do all your exercises, but you just keep sitting hunched over a desk, or you keep doing the behavior that's causing the problem, it's like scratching a scab. It never goes away. It just keeps recurring. And you end up in this chronic pain cycle. Or you go to the chiropractor, for example, get adjusted, feel better, and then a month later, 2 weeks later, you got back pain again. And it just feels like, well, I've just got to keep going to get out of back pain rather than stabilizing it. So it's those three things. Now, a couple breaking bad habits things that we find are common that I just want to talk to you about. And we talk about this traffic light approach because there's this concept of things that we should absolutely stop doing, things we should just slow down on doing, and things we need to start doing. So number one, drink more water. And I cannot overemphasize that we should all drink more water. So if you're a female, typically you want to drink about 2.5 liters a day. If you're a bloke, 3 up to 4 liters of water a day. Now, apart from keeping hydrated and flushing everything out, what it's actually going to do is hydrate your disc better, and it's going to hydrate those facet joints better so that they can glide and move better. Both are crucial. And I'll tell you, if you've got back pain and you just start drinking more water, 9 times out of 10, this is going to start to reduce your pain. Side note, if you wake up in the morning, get out of bed, and every step feels like your ankles are breaking or your knees are breaking or there's like you're getting that sharp pain, drink more water. There's a very good chance that you don't have enough hydration, so you don't have enough oil and fluid in that synovial fluid lubricating those joints. If you just drink more water, it will feel better. Walk. Just get moving. It doesn't have to be crazy. It just has to be movement. The minimum, they say, is 12,000 steps a day as a bare minimum. I think most people get somewhere like 2,000 or 3,000. So 12,000 at a minimum, up to 20,000, 30,000 if you can. But by moving, what you're really doing is you're getting your facet joints moving properly, you're hydrating your discs, you're activating proprioception in your nervous system, which is helping keeping your nervous system functioning at its best, keeping you healthy, activating your postural muscles. We all know we should do it. It's just one of those things. And then if you're sitting a lot, 2 things. Sit on a wobble disc, just like the ones you see in our office where you can wobble, keep your disc hydrated, you keep moving whilst you're sitting there. And 2, take your micro breaks. So your postural muscles will start to turn off after about 30 to 40 minutes of sitting, which means after 30 to 40 minutes of sitting, you want to get up and get moving to reactivate them. Now, lastly, there's a series of exercises I'm going to walk you through, and these are good to either activate your postural muscles. So if you want something to do on a micro break, or if you actually have back pain, these will relieve your back pain 9 times out of 10. So what I suggest is stand up and actually do these so that you get the memory. But if you're standing up, you want your feet about 1 fist width apart, and you want your feet pointing straight ahead. Now, as you stand up nice and tall, what you want to do is then clench your backside. So make a muscle, really squeeze your butt as tight as you possibly can. You're going to hold that for 3 seconds. Once you do that, you're going to relax. You're going to repeat that 5 times, just clenching that butt. Once you do that, then I want your heels touching and your feet pointing out at 45 degrees, kind of like a penguin. Stand up straight, clench your backside, hold it really tight, 3 seconds. You're going to repeat that 5 times. And once you've done that, then you're going to turn so your toes are touching and your heels are apart. So you're kind of pigeon-toed. And this time you're going to clench your quad muscles as tight as you can, 3 seconds, 5 repetitions. Just be wary of this one, it'll pull you forward. You want to make sure that you stand up straight. Now that'll activate your pelvic muscles, activate your core. Then what you want to do is get your upper. So if you arms are outstretched, palm up, pin your shoulder blades back together and down, and you want to do 30 circles. And this is activating and agitating the muscles in your spine by keeping your shoulder blades pinned. Then palm down, pin them shoulder blades back together and do 30 more circles. The real key is keep your shoulder blades pinned the entire time. So if you're doing this properly, your butt's going to burn, your shoulder blades are going to burn. That's a good thing. And you're activating those muscles. Next time you got some back pain, just try it out. Let me know how it goes because I bet you it's going to help. All right. So this is an example. I want to introduce you guys to a guy called Scott. So Scott's a plumber. I've been working with him for a couple of years. The x-ray on the left is when Scott first started care. Now, this is his lower back from side on. So hopefully you can see this blue line here is normal. And the red line is what he's actually doing. That's his tailbone down there. So that's his back, that's his belly. And you can see he's way out of line. So when he came in, he was doing this. He was full on bent forward. This is what you call antalgia. And what you can see there is there's a kink right there. So he'd blown his L4, L5 disc. This is a bulging disc. And his body was basically shunting him forward, trying to get the pressure off his spine. Raging sciatica, couldn't work. So we got to working on him. And we took another x-ray after 3 months because you want to see how things are actually changing, right? That's the whole point. You want to know, one, what are we starting with? What can we do? And then let's test it to see how you're actually tracking. So 3 months later, sciatica was gone. Still got some sort of soreness in the low back, but was back working, wasn't missing any days of work. And you can see how much that's come back. Now, what that's actually showing you is that we've taken that kink out, taken the bulge out of that disc, so the pressure's off the nerve. So now he's losing that antalgia. He can start to stand more relaxed. His body's not forcing him out of line. You can see it's still not perfect because he's still shifting too far forward. Now, if we'd left it there, because that's shifting forward, it's a weak state. It's a weak state. So if he was to stand there talking to someone, he's going to have to keep moving intermittently because his back's going to get sore pretty quick because the muscles are working too hard to stabilize it. So kept working on it, exercised, etc. Took another x-ray. This was 15 months later. You can see that's pretty much bang on. So that is what you call a corrected spine. It's made it as strong as it can be from an alignment perspective, which is pretty cool. So I show you these because a lot of time people say, well, you can't fix a bulging disc or you can't really make a change here or whatever it is. We do, we can. And we take x-rays and we show you the before and after so you can actually see it. Pretty cool. Thank you, guys. One last piece is next month I'm pretty sure we're doing headaches, but you'll see some emails coming out about that in the next week. So jump on that and I hope to see you there too.